I'd now like to demonstrate for you a barbecue roll treatment for horizontal canal canalithiasis BPPV. So we're going to assume that our patient here has right-sided free-floating debris in her horizontal canal. We have her already in a supine position with the head flexed to about 30 degrees in order to help orient the horizontal canal and the vertical plane of gravity. And so in order to first start this treatment technique, we're actually going to be putting her into a right roll testing position, which is an assessment technique for horizontal canal canalithiasis or cupulolithiasis. So we're going to roll her here to the right. The patient starts in this position for the treatment, and if we were here to identify it, we would be hoping to notice what would be direction changing geotropic nystagmus, both on the right and on the left side for the roll test. That's in a different video. So assuming that we've already identified the right side, we would be seeing geotropic nystagmus of short duration here, coupled with vertiginous symptoms, and this would be her more symptomatic side. So anyways, we're at the right side, and she's got right horizontal canal canalithiasis. So in order to go through the barbecue roll test, we're going to let her symptoms subside, double that duration, and then we're going to roll her here into midline. Now that she's in midline, we'll wait for 15 seconds and again continue to assess for nystagmus or symptoms throughout the entire duration of this treatment. After 15 seconds have passed, we're next going to roll her 90 degrees to her left side. And she's going to again maintain this position for an additional 15 seconds. Now, the following maneuver is for her to roll completely onto her belly, and we'll also ask the patient to assume a prone on elbows position. So, what I'm going to do as the clinician is I'm going to hold her head on her body while she rolls until her head is facing the plinth. Alright, so continue to roll for me. Roll, 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 roll. And then I'm going to hold her head there, and I'm going to bring her into about 20 to 30 degrees of cervical flexion, or she can stay in a neutral position as well. Both are appropriate. And here, what we're assuming is that the canal, or the debris, has evacuated the canal completely, and she should be asymptomatic. If we want to do the 270-degree barbecue roll, we're in the proper position to ask our patient to go ahead and come up onto their hands and knees. So go ahead and come up on your hands and knees for me. Keep the head flexed down right through here, all right? And if the treatment was effective, she'd be asymptomatic. However, assuming that it wasn't effective, we would want to make sure that we guard our patients regardless of the circumstances, okay? So next, she could just go ahead and step off to the side and come on up. And make sure that you're holding and guarding your patient the entire time. And that's how you can execute a 270-degree barbecue roll test. Barbecue roll treatment.